who is that who is going to guide us to operate on the standard operating procedures? For me, I cannot decide on that because I'm just merely a doctor. I can give the doctor's point of view. But we need a committee that would have a representative of a WHO, a committee that would have a representative from the CDC, Center for Disease Control, a committee that would have a representative from the ICMR, from the Public Health Department, from the Epidemiology Department, or epidemiological technocrats, and the Preventive and Social Medicine. The last four we have in Goa itself. But the earlier three, we have to maybe ask somebody to represent into a committee, and we may have to tag them on to decide what is our cases, how are things going on, and accordingly they could recommend what has been happening. So when people who are not sitting in this committee and deciding on, or part of the members are deciding on, then these are the flaws that we see, and we find that the cases are coming up because there's nobody to guide us. It's a new virus. Whatever we know, we are knowing very little about it. Even in the management protocol, things are being changing today. So that's where things have gone wrong. But that is where the government has failed. They worked in a very close-knit small team. Instead of that close-knit small team, what they should have done is they should have made a broader committee, and that broader committee would have helped them because everybody has got their expertise in a particular field. Like, for example, you are in social media. Everybody will say, what is Armstrong up to? But you are educating people. You are taking Jorson, hooking him on and educating people. Where this video will go and how much of effect it will have, I cannot measure it. It's only a person in media can measure it. So it's not that Armstrong is a small man and he doesn't do anything. You are going to reach out to people, and you're going to reach out to people in a different means which I cannot do. So why should I leave Armstrong out when Armstrong is doing such a beautiful job for me? So that is what is very important for all of us to understand. A broad-based committee would have given us a broader reach out, a vast reach out to people on this disease pathology so that people could have understood what it was. So that's where the government has failed. Precautionary measures like that of wearing a mask, not touching your eyes, nose, and the mouth without washing with soap and water is very important. The dictum that we should not forget is wherever there is clean water and soap, there is hope. So washing with soap is more important. People are under the impression that if you have a sanitizer, it is enough. Sanitizer is an alternative. It only reduces transmission. But soap and water, it kills the virus. It's very important for us. Not that the sanitizer doesn't kill, it also kills the virus. But wherever there is soap and water not available, like when we enter into a bus, we touch the rod, we touch the seat, back seat. So that is where the sanitizer is useful for us. But whenever we are having a facility for a wash station, we must wash our hands, that too frequently, and we must take 20 seconds from scrubbing to scrubbing. These are important precautionary measures that we have to take. Sanitizer, washing with soap, wearing a mask, not touching your eyes, nose, and mouth without washing your hands. These are important features. And the last, but the most important one, is social distancing. You refrain and restrain from getting into gatherings, merging yourself into larger groups. Wherever you are going, you should not hang around for too long a time. Don't touch those objects or fomites unnecessarily, uncalled for when you're not supposed to touch. These are important features that we have to take care. And this health education is one of the important facets that we should give it to all our people, wherever they come from. They are our own brothers and sisters, whether they come from any part of the world or whether they come from India. I think it is important for us to give them this health education because that will bring about a behavior change. People are not wearing masks. People are not washing their hands. People are not knowing what is social distancing. These are newer norms. Only when they are educated, they'll start following this. The University Grants Commission has given them 3 options. One option is they can conduct their exams online. Second one is offline, or third one is a blended one. You can conduct, if there are practicals, maybe offline, and the theory could be online. So they have given them these options. But the risky proposition is, without having the infrastructure which they need, if they are not maintaining the infrastructure, it is going to be very, very difficult for them to manage it. Just to cite you an example, we both started, you and me started in the same Our Lady of Health High School. You must be remembering our hand washing station. That small little thing was there in which there were 4 taps and every child would come, stand in a line, and they would wash their hands. Now, can we think of something like that during the time of pandemic? No. The reason is because when we are talking about social distancing, we'll have to run only 2 taps now. We can't run all the 4 taps. So one to this extreme, one to that extreme. So 2 taps have to be locked up and kept because we have to maintain that distance. That's number 1. Number 2, that means the number of students, 600 students into the school, they will take longer time to wash their hands. Therefore, the interval time has to be increased. Now, this is what the epidemiological technocrats start working on and designing the infrastructural requirement for a large number. If you are going to wash your hands for 20 seconds from scrubbing to scrubbing, 10 seconds for dabbing your hands and drying your hands and for wetting your hands, then you are going to take half a minute. 600 students, you are going to take 300 minutes. Half a minute means 300 minutes for washing your hand once. And then if you are with one tap, and that also, if you are going to have one soon after the interval, one after coming from the toilet, one after eating your food, you're going to take about 1.5 minutes per student. So you can imagine. And now divide that by the number of wash basins that you have got. So you need a huge wash station where you need at least about 20 to 30 taps. So that 20 to 30 taps, 20 to 30 soap cakes for everybody to wash their hands, it is going to cost money. So you have to make this infrastructure ready, and that is the purpose of this lockdown period. That is what we talk about restrictions in social distancing. So naturally you will say, I don't want the full class strength to come in. I want 50% to come in. Maybe 5th standard, 7th standard, 9th standard will come on one day. 4th standard, 6th standard, 8th standard, 10th standard will come on the other day. So we put restriction, which is part of social distancing. Particular survey that was being done, it was very simple survey. It could have been done by the IMA members, Indian Medical Association members. That's my view about it. Like for example, if you ask me in my ward, I know everybody's phone numbers. Even about 30 households, I could have done the survey and given them. There was no need of sending even a teacher. We have got our other family physicians who know so many patients. They are personal patients to them. They know them very well because these patients have been coming for hypertension, diabetes for years together. So those people would have given a full history of each of those families, and we could have conducted the report just on a WhatsApp, just on any other ordinary media that we have got into our mobile. And everybody had that time during the lockdown, 1 month we were at home. We had nothing to do. The physicians could have been put to work. We understand the systems better. We understand the science better. So there was no reason for the teacher to be put onto this. The IMA could have been used. So it's all working together, which is important. You cannot have the teachers put onto a job which they find it difficult to assess. Then what happened after the survey? They only came to know how many people are there, and they said that they would do the test. They never did the test, so nobody knew what was the fallout of that particular survey. Fine enough, you have done a survey, you have wasted the teachers' time, they have gone around to all the schools, but that survey hasn't helped anybody at all, absolutely. You only knew how many people are having influenza-like illness, ILI. Other than that, there's nothing much that we were concerned about out of that survey that came in. But no data also is being fed and given to the people also apart from that survey. If the teachers were being actually trained on health education on COVID-19, that would have been wonderful. Because what would have happened is during that 1 month period, through the Zoom, through the Google Meet, through the Google Classroom, they could have trained more than about 50,000 students, 50,000 family members, and then the ripple effect could have been fantastic for us during the lockdown. That is where the government failed in conducting this COVID-19 awareness campaign, because that would have helped all our student community, that would have helped our parents, as well as all our neighborhoods would have come to know what this disease is, and that would have brought a behavior change. You go to our market in Kunkulim today, people are without wearing a mask, they tie a kerchief, and the lower part is all open. So all the aerosols, all the droplet nuclei are coming out from there, and that's dangerous. So smaller kids who are of a lesser height, they will breathe in all that because everybody is moving around today. So they need to wear a mask that's going to cover their nose and mouth. Many people do not know why you should not touch the eye. They are saying nose, mouth, okay, because the replication of the virus takes place in the respiratory mucosa. But they are not realizing that the eye has got a duct called as the nasolacrimal duct from the nose to our tear gland, the lacrimal gland. So when you touch your eyes through that duct, it comes into our respiratory tract. And that's the reason you must not touch the eyes. So these are small things. The 7 steps in washing of hands, the ringer roses that we do to teach our school children would have been a wonderful thing for people to learn more, and that would have brought a behavior change. And that's why what I firmly feel, even